Welcome to The Explainer. Today, we're diving into a really strange medical mystery, one where the human skeleton just starts behaving oddly. We're talking about new bone growth that literally looks like dripping candle wax. So, what if your own skeleton started growing extra bone? I mean, just picture it. Your spine, right? It's supposed to be this flexible column of individual bones, but imagine it started to fuse together, and not because of some injury, but just because. Your body just spontaneously decides to build these new flowing bridges of bone all along its length. And believe it or not, this is what that actually looks like. This CT scan shows these thick, white, flowing bridges of new bone, just connecting the vertebrae. It's wild. And this, right here, is the classic sign of a condition called DISH. So let's get into it. What exactly is this thing? Well, a big clue is actually hiding right in its very long name. Yeah, the name itself is basically a set of clues. Diffuse tells us it's widespread, not just in one little spot. Idiopathic, that's the classic medical term for we don't really know the cause yet. That's the big mystery here. And skeletal hyperostosis, that just means too much bone growth. So when you put it all together, it's a very literal description of what doctors are seeing. Okay, so with any medical mystery, you've got to have some clear rules for identifying it, right? And for DISH, that story really gets going back in the 1970s when one doctor decided it was time to create a definitive checklist. Now, people had been describing this condition since at least 1950, but it was a guy named Dr. Donald Resnick who really changed the game. He's the one who gave it the modern name we use, DISH. And most importantly, he's the one who laid out the strict rules for diagnosing it that are, believe it or not, still the gold standard today. So, what's on that checklist? It really comes down to three key things. First, doctors are looking for that signature flowing bone that connects at least 4 vertebrae in a row. Second, and this is really interesting, the discs between those bones have to look pretty healthy. That's a huge clue that this isn't just normal wear and tear. And finally, they have to make sure no other conditions that can cause similar fusions are present. Gotta rule out the other possibilities. All right, so now we know how to spot DISH. The next question is, who gets it? Who are the usual suspects? Well, when you look at the data, a surprisingly consistent picture starts to emerge. And yeah, it turns out the patient profile is remarkably consistent. Researchers have really narrowed it down to a handful of key risk factors that seem to be strongly connected to this condition. And here they are. To put it simply, DISH is really, really strongly linked to a few things: getting older, being male, and having a whole cluster of conditions that fall under the umbrella of metabolic syndrome. We're talking about things like obesity, type 2 diabetes, and high blood pressure. Which is fascinating, right? It shows this unexpected link between how your body processes energy and what's happening in your spine. And just look at this graph. The numbers are pretty striking. See how the prevalence of DISH just skyrockets after age 50? And look at the gap between those two lines. That's the difference between men and women. It's way more common in men, and that gap just gets wider and wider as people get older. Okay, so this all brings us to probably the most important question. Why does this matter? I mean, so what? What are the actual real-world consequences when your spine starts slowly turning into a solid piece of bone? Well, here's where the story takes a bit of a twist. You'd think with something that looks so dramatic on a scan, it would be a huge problem, right? But for a lot of people with DISH, they don't have any symptoms at all. It's often just found by accident, when they're getting an X-ray for something totally different. But for the people who do have symptoms, the problems can be very, very real. We're talking about things like back pain and a whole lot of stiffness. And if that extra bone growth is happening in the neck, it can physically push on the esophagus, which makes it hard to swallow. It can even press on the windpipe and block the airway. On top of that, it can stiffen up the whole rib cage, which actually reduces how much air your lungs can hold. But by far, the single most dangerous thing about DISH is this. It leads to a 4-fold increase in the risk of a spinal fracture. 4 times. Now, I know what you might be thinking. Wouldn't a thicker, fused spine actually be stronger? It seems like it should be, but it's the complete opposite. When the spine fuses like that, it loses all its flexibility, its ability to absorb shock. It basically starts acting like one long, brittle stick, which makes it way more likely to break, sometimes from even a minor fall. And what's even worse is that when these fractures do happen, they are incredibly dangerous. Because the spine just snaps like a twig, it creates these really unstable breaks. And that leads to a shockingly high risk of injuring the spinal cord itself. We're talking up to 58% in some studies. This is why spotting this condition early is so important. So this brings us all the way back to where we started, back to that central mystery. Remember the eye and dish? Idiopathic. We know what it looks like, we know who tends to get it, and we know how dangerous it can be, but we still don't know exactly why it happens. But here's the thing. Scientists believe that if we can solve this puzzle, the implications could be huge. I mean, think about it. If we can figure out what switch in the body is turning on all this unwanted bone growth, maybe we can figure out how to control it. And that could totally revolutionize how we think about bone healing and regeneration. Right now, a lot of the research is focused on this tiny microscopic level. There's a structure called the enthesis. It's the exact spot where your ligaments and tendons anchor into your bones. And the leading theory right now is that those metabolic factors we talked about earlier, things like the high insulin levels you see in a lot of DISH patients, are sending the wrong signals to the cells right there at the enthesis, basically telling them, hey, start building new bone. And that leaves us with a really fascinating final thought. If we can solve the mystery of DISH and figure out how to turn this bone-making process off, could we also learn how to turn it on when we actually need it? You know, for people with really bad fractures that won't heal, or for those with osteoporosis. It's a wild idea, right? Solving the mystery of too much bone might just be the key to learning how to create new bone exactly where we want it.